How sterile does the home need to be upon return?
In terms of going back home, right, when the patient goes back home, the house doesn't need to be sterilized, right? If you think about it, the place where you were staying, either if you did your transplant in the hospital, right, the hospital is not a clean place, right? There are very nasty bacteria that are there that remains in the floors or in the walls or in the equipment, even though those are clean. And then if you're doing this outpatient, you're probably staying in a hotel, you're probably staying in another apartment that you rented or something like that, right? So those places are also not bacteria free. These are not completely sterile areas. When you go home, basically what we will tell the patients is just a regular good spring cleaning, right? That's enough. For the patient itself, in terms of what they can do, I tell them once they are home and if they have the energy to do it, they will do the clean stuff, right? What is the clean stuff? Like for example, taking the clothes out from the dryer, right? Taking the plates from the washer once they are clean, those kind of things, right? Small tasks if they feel doing them, right? If they have the stamina, if they have recovered and they want to do that. Dusting around, cleaning areas that look that there is mold around, mowing the lawn, those things I will say no, at least until the day 90 when they start getting their immunizations. Not that that's going to prevent many of those things, but they need to be mindful about they are at higher risk at those times for potentially either fungal pneumonia or other things. That's why we talk to the patients about having a caregiver at least for the first 30 days, right? This caregiver is going to do those things that the patient is not allowed to do, and it's also going to supervise, medications if they are eating, if they're drinking, bringing them to the clinic and so forth.
I think it is good to have a clean home environment, but I don't think patients necessarily need to stay away from their houseplants and so on. We do tell them to be careful. Try not to clean out the attic, try not to clean out the basement. If you're going to be out weeding things or out where there's a lot of fungus and so on, that you might want to be careful and wear a mask and take common sense precautions.
Can transplant patients have pets in their home when they initially return home?
When it comes to pets, there's certain pets that we ask them to remove from their house in that first initial period. And those are usually birds, exotic animals, things like that pose an additional risk. But when it comes to cats and dogs, we want them to have their loved pets in their environment as long as they engage in safe practices. So usually we ask them not to pick up after the pets, scrupulous hand hygiene if they're rubbing their pets, not to allow the pets to kiss them in the face and lick their face in that period. But the pets don't have to be removed from the home. We try to have those things that are important to patients in their lives present as long as we can mitigate and minimise those risks. Now, obviously, institutional practices can vary from place to place, but that's our practice at Moffitt.
The answers are somewhat operator dependent. Different physicians feel a little bit differently about this. I was one of those physicians that used to feel that post-transplant patients should stay away from their pets for 3 months at a time. And I don't necessarily feel that way now, but I do feel certain basic guidelines are important. For instance, I would suggest to patients that it is important not to clean up kitty litter or to take the dog out for a walk. I would tell them to be careful about being scratched by animals. I don't necessarily feel strongly that patients have to house their pets somewhere else post-transplant. I feel that during the transplant period, it's most important to be safe and keep distance from anything that might be a focus of infection. But with respect to animals, I think the paradigm is changing over time and people are becoming more liberal about how patients can interact with their pets. Still, it's important to be careful, stay away from litter, stay away from poop. You should manage to stay safe in that setting.
The patient could still pet their dog or cat and then wash their hands, right? We also advise the patients not to sleep in the same bed with the pets, right? Pets can be in the same room potentially, but in their own place, right? And then there are certain pets that are more exotic, right? Like parrots, like turtles, iguanas. Those carry specific bacteria, and that the patients may be more susceptible. So those ones will prefer the patients living at home, maybe board them somewhere else. But a regular cat or a dog should be okay to be with them.
What guidance is given on house plants, gardening, and yard work?
When it comes to house plants and gardening, our recommendations are they can have plants inside their home, but not to engage in digging in the soil or liberating the soil in any way, because the theory is that that might liberate things into the air, into the atmosphere that they could breathe in and put them at risk from that perspective. We ask them not to engage in gardening in the first 90 days after they have their transplant, because again, for that same reason, digging around in the soil is potentially going to liberate molds and things that we don't want them breathing in.
I think that houseplants, a little bit of, like collecting your tomatoes from the garden and things like that is probably fine. Anything where you're really in the soil, digging a lot in the soil, where you're at risk of cutting your skin and injuring yourself is something that is probably better to avoid for a few months after a transplant.
What guidance is given on when it is safe to mow the lawn?
I will say, once your energy is back and then you protect yourself, right? Because mowing the lawn sometimes, will remove spores, like fungal spores, right? I will say, wait at least for the first 90 days once you want to engage on doing some of those things, but protect yourself as well.
What guidance is given on swimming in hot tubs?
In terms of swimming in the pool, right? What I tell my patients is if it's the pool in your house that you clean, you don't share it with all of people, right? It's well maintained. Then my rule is as follows. They cannot go to the pool at least until 10 days after their line was removed, right? Because we want the area to be well healed. When we talk about the ocean, I say they should wait at least after the day 30 and at least 2 weeks from the line removal. And similar precautions in terms of the sun, right? To have either wear long sleeve or, those special clothing with UV filters and such, or wearing a sunscreen. I also try to avoid telling them, okay, they can go to the beach, just go into the water a little bit, but, maybe strenuous, swimming into that, right, with the risk of potentially swallowing water, placing a risk for probably some GI upset or something like that, right? So, or also they will be feeling very tired. So I doubt many patients will go into the beach to swim, right, like a mile, like they used to do before, right? So that would probably be complicated to do. Hot tubs are also kind of the same similar scenario, like the pool. If it's at your house, it's clean and those things, sure, after the day 30 probably should be okay. If this is a public sharing, there's a different situation, right? For those things, I would say wait until the day 90 when you start your immunizations. You will be not necessarily fully immune reconstituted, but your counts will be more stable. We will know exactly you are not neutropenic anymore.
You have a sense of whether you feel that the pool is maintained well. Some people really do enjoy going to the pool, and I often suggest that they just call and they ask, what times of day is it much less crowded? I think that it makes sense if you know your pool. Not necessarily because of the pool itself, but because of the changing rooms, and the areas around the pool can sometimes be really packed, and you perhaps want to have a little bit more breathing room around you.
What should transplant patients know about sun exposure after transplant?
After patients are exposed to high-dose chemotherapy, in this case melphalan, right? They are all going to be more sensitive to develop other cancers down the road. We have discussed about, for example, leukemia, myelodysplastic syndrome, but at the same time, there are some other non-hematological cancers that become more frequent, right? And those are specifically talking about skin cancers, right? So a good advice for patients after transplant is to keep a dermatology appointment for a full skin exam at least once a year. Patients who already have sun damage in their skin, right? They are particularly more susceptible to develop these basocellular carcinomas or squamous cell carcinomas. Fortunately, most of those cancers are going to be handled by your dermatologist, right? So if you keep a regular appointment with them at least once a year, they will be able to detect these lesions very early on, provide therapy for them, right? They either can froze those lesions, they could probably shave it off to sort of also have tissue to prove what type of cancer it is in the skin, or whether or not this is a pre-cancerous lesion that they are addressing early on.
What guidance is given on piercings and tattoos?
I would say piercings also will wait at least 30 days. Need to make sure, your counts are fully recovered, right? Your platelets, because you don't want to be bleeding from the area where they are doing the piercing, right? That your neutrophil count is completely normal, right? And then, also figure out where are you going to do this procedure, right? Don't go to, the first place it cross your way to do it, right? Do some research, see how clean they are, those kind of things, right? Tattoos, I will say I will wait at least for after the first 90 days because it's a more involved process, right? Tattoos are not done in one single day. They requires the markings, the continue to stain the area, right? And there is a higher risk for infections, right? So also find the right place to do it.